lack of nitric oxide is affecting the heart, affecting the brain, affecting almost every organ because the blood flow is not proper.
It's a systemic problem. I think the bigger problem is the use of fluoride and antiseptic mouthwash. People with previous heart attack, kidney disease, pulmonary disease, high blood pressure, all those are symptoms of nitric oxide deficiency. They need nitric oxide because your body cannot and will not heal without it.
How long will it take to shift from a bad system to a good system?
Now, look, I think it's the most important question. I, too, am less interested in promoting products rather than promoting a good lifestyle so that your body can naturally produce nitric oxide. There's only 2 people in the world who need nitric oxide.
I'm Dr. Esra and I've been living a sober life for the past 18 years. My battle with addiction drove me to seek new methods, devices, and supplements to improve my physical and mental performance, enhance my quality of life, and ultimately live healthier for longer. From my experiences in addiction recovery, biohacking, and longevity to the latest global developments, from groundbreaking entrepreneurs to expert academics, the conversations I've had over the years are now featured weekly on Soberhead Podcast. Welcome to Soberhead Podcast. Today, we dive into a molecule just might hold the key to our overall health, nitric oxide. My guest, Dr. Nathan Bryan, is a pioneering researcher who has spent his career uncovering how this tiny gas regulates blood pressure, protects our cardiovascular system, and even impacts brain health and sexual function. In this episode, we explore the pathways of nitric oxide production, why most chronic diseases can be traced back to its loss, and how lifestyle choices from diet to sugar intake shape our nitric oxide levels, and explains how this science is reshaping our approach to conditions like Alzheimer's, erectile dysfunction, and cardiovascular disease. If you've ever wondered how to improve your health through simple lifestyle changes, support your endothelial function, or even discover why nitric oxide could revolutionize modern medicine, this is the conversation you don't want to miss. This episode of Soberhead Podcast is brought to you with the support of Gedik Foundation for Education. For over 30 years, Gedik Foundation has been providing opportunities for youngsters, children, and women to realize their dreams through scholarships, projects, and social work. And we're proud to be on this journey together. Investing in education is investment in the future. Subscribe and support us in our quest to bring you the most current scientific data and continue your access to the world-renowned experts in their fields as guests on Soberhead, with Turkish translation and completely free of charge. Comment on the episodes, like, and share. Dr. Nathan Bryan, welcome to Soberhead Podcast. This was long time coming.
It's great to finally connect with you and be with you.
Exactly. But I have an interesting story. It was 2023 in December. After a couple of years, it was my first A4M conference that I came, and your lecture was the first lecture that I listened. Your lecture was the prior to the conference, like there's this one day
the
lecture series, pre-conference thing. And, I decided to pick that topic for some reason without even knowing what I was going to listen. I had no idea what I was going to hear, but I shared that with my audience. It was my third podcast, I think. I shared what I learned. Today, we're going to talk about nitric oxide. I'm going to not spoil the podcast by sharing what it does because I will let you do it, but I will tell what I learned up from your talk that day. And it was that, do not use the mouthwash. And up until that time, I was using the Listerine up and down every day, multiple times a day. And, it felt good, it felt refreshing. And when I listened to your talk, I was like, oh my God. That day, I threw everything away. And the second thing, it was like 2 things stayed in my mind. One is the do not use the mouthwash. Number 2 was, there are many things, but number 2 is that if you want to get nitric oxide from the food, you need to eat like 2 pounds of spinach every day. There was something like that. Yeah, correct? Yeah, I'm like, all right, so welcome to the show. It seems like it's a very important molecule and it has a Nobel Prize won because of Farid Murad, Robert Furchgott, and Luis Ignarro. Yeah, these three guys like came up with this molecule. What it does actually, it was known. But what made you pick nitric oxide?
We know shortly after the Nobel Prize was awarded in 1998, I was a student at LSU School of Medicine, and I was introduced to this whole new science of nitric oxide. So as you said, those three U.S. scientists discovered that nitric oxide is a signaling molecule that's naturally produced in the body of humans. And it was a profound discovery that led to a Nobel Prize. So even at that time, we knew that nitric oxide was extremely important. We knew that most diseases were associated with a loss of nitric oxide production. Mm-hmm. If we could figure out, and this was really communicated to me by Lou Ignara, who came to and gave a lecture, and I had a chance to have a conversation with him. He says, Ethan, if we can figure out what goes wrong in people that can't make nitric oxide and then develop safe and effective nitric oxide products, drug technology, drug therapy, it would change the world. Then the challenge was on because, okay, well, then we had certain questions to answer. Number one, how does the human body make nitric oxide? What is it that leads to a natural decline in the production of nitric oxide? And then once we understood that, then we could start to develop rational therapies, right? But, you know, if you don't understand how the human body makes it, and you don't understand the biochemistry and the enzymology, and you don't understand these mechanisms, then you really have no idea on how to develop nitric oxide products. And you know, today we've got hundreds of companies out there selling so-called nitric oxide products, and not only do they do not work, they cannot work because these companies don't understand the basic science. And so that's kind of where we've differentiated ourselves. But, you know, going back to your question, we dug in and tried to, you know, we developed some analytical instruments and technology that we could detect nitric oxide gas in biological samples and create a fingerprint of nanobiology in different diseases. Mm-hmm. And then that armed us with a tool and technology that very few other research groups had in the world. So we've been leading the charge now for more than 25 years.
It seems like there are a couple of pathways that the body produces nitric oxide. Shall we start there?
It's the baseline because, again, if you don't understand how the human body makes it and then what leads to a loss of its production, then you can't address it. Mm-hmm. So the first pathway to be discovered, and this was really what led to the Nobel Prize, was there was the recognition or discovery of an enzyme in the lining of the blood vessels, and these are the endothelial cells that line all blood vessels throughout the body. And this enzyme called nitric oxide synthase takes an amino acid L-arginine and through a very complex biochemical reaction produces nitric oxide gas. And this production is what's responsible for the second-to-second regulation, vasodilation of blood vessels that controls blood flow and oxygen delivery to every organ, tissue, and cell in the body. The best example is if we're about to engage in sexual activity, we've got to dilate the blood vessels of the sex organs. And so if your body makes sufficient nitric oxide, it dilates the blood vessels, we get engorgement that leads to, erections in both men and women. But if you can't make nitric oxide, you don't get vasodilation, you don't get engorgement, and that's what we call erectile dysfunction. It's the loss of function of the enzyme. So it's never a deficiency of arginine that leads to nitric oxide deficiency. So supplementing with arginine and citrulline-based products doesn't fix the problem. In fact, it can make things worse. So that's number one. We have to focus on the function of the enzyme and restore the function of the enzyme. And then the second pathway that was discovered probably 25 years ago, maybe a little longer, was through, and you brought it up, it's through the foods we eat and the presence of oral bacteria and the presence of stomach acid. So, and we've done surveys all across the U.S. trying to figure out how much spinach or celery or kale would you need to eat to optimize your nitric oxide production. And we found that it's almost impossible to eat enough foods to get enough nitrate to promote nitric oxide production. But I think the bigger problem is the use of fluoride and antiseptic mouthwash, because nitrate, we got to remember, is inert in humans. And so if we don't have the right bacteria in and on our body, we excrete it unchanged. We excrete it in the urine, in the feces, and in the sweat. So if you were doing like you were doing and using Listerine, which kills 99.99% of the bacteria in your mouth, it completely disrupts the nitric oxide production from the diet. Then the other problem is fluoride. There's fluoride in toothpaste. There's fluoride in the water, the drinking water, the water we shower in and bathe in and cook in. And they put fluoride in the water because it kills the bacteria in the water. Well, it also kills the bacteria in and on your body. And it causes complete dysbiosis and causes human disease. And then the other big contributor to nitric oxide deficiency, because it's disrupting this pathway, is the use of antacids. There's 100 million prescriptions written for antacids every year in the U.S. alone. And now it's estimated that 2 out of 3 Americans use over-the-counter antacids. So you don't even have to have a prescription for these drugs anymore. You can buy them over-the-counter, and they're completely shutting down nitric oxide production and causing a 40% increase in heart attack, stroke, and Alzheimer's. So again, once we understand how the human body makes nitric oxide and how to optimize this, then we can start to figure out, okay, what's disrupting each step in this process? And then once you do that, then you can stop or eliminate these things that are disrupting nitric oxide production, and now start doing the things that we and others have shown to be clinically proven to restore and activate nitric oxide production. And it changes people's lives when you do that.
Can we measure on someone how much nitric oxide they produce?
You know, there are functional medical devices that what we call venous occlusion plethysmography, but this is looking at, you know, the responsiveness to blood vessels to a lack of oxygen. So when you occlude blood flow to a region, to a vascular bed for a period of, say, 5 minutes, and you now release that cuff and restore flow, the body's natural response is to produce a lot of nitric oxide gas to dilate those downstream blood vessels that have been deprived of oxygen. And we can measure that. You can look at it through an ultrasound probe and look at the degree of vasodilation and other measurement devices. But if your body can't make nitric oxide, then you don't get any what's called flow-mediated dilatation, and that's a measure of endothelial dysfunction. But because nitric oxide is a gas, that once it's produced, it's gone in less than a second. We can't do blood draws and, you know, get a number like we can for cholesterol or triglycerides or vitamin D, because it's a gas. I mean, in the research environment, we can look at certain metabolites of nitric oxide and get a pretty good indication of, you know, what your nitric oxide production capacity is, but clinically it's really not used. So then we have to rely on symptoms. And so we find that, you know, erectile dysfunction is the first sign and symptom, and then you start to see an increase in blood pressure. Then you develop metabolic disease, insulin resistance. You develop exercise intolerance. You get short of breath walking up a flight of stairs, and then, you know, lastly, you start to develop mild cognitive impairment, dementia, and eventually Alzheimer's. So that's the hierarchy of symptoms that start to manifest if you lose the ability to produce nitric oxide and don't do something about it.
I was reading, everything is so connected. I know that, you know, in your talks, you keep saying the holy grail of the molecules, but I didn't really realize that was so connected to all of these things. So one pathway is through the mouth, obviously, and through the gut. And the other pathway is in the endothelial cell. No other pathways that we produce?
Well, there are. That's the primary endogenous pathways. You know, we know that sunlight, certain frequencies of light, whether it's the UV spectrum or the, you know, full spectrum infrared, those frequencies of light and energy can release nitric oxide bound to metals or bound to proteins. So it can kind of remobilize nitric oxide that was once produced, but it really doesn't stimulate endogenous production. It can reactivate nitric oxide that has already been produced. You know, there's still a pretty active research group worldwide on nitric oxide. In fact, I'm hosting the 2026 International Nitric Oxide meeting in Austin, April 23rd through the 25th. And so, you know, as we advance the science, there may be other mechanisms that are discovered, but to date, it's really only through the endothelial cells and through this enterosalivary circuit based on diet, oral bacteria, and stomach acid production. Those are the primary pathways to produce nitric oxide.
Let's say that, okay, the person stopped, or the person was using the mouthwash and the antacids and stuff so that they stopped the production through the mouth. What would be the causes to not to produce through the endothelial cells, the nitric oxide?
Well, we have to look at the enzymology of the function of the enzyme, nitric oxide synthase. And so, you know, probably 30 years ago, maybe longer, it was first discovered that the rate-limiting step in the function of that enzyme is oxidation of tetrahydrobiopterin. So there's 8 different cofactors and substrates that are required to make nitric oxide through that enzyme. But it's the oxidation of BH4 that leads to NOS uncoupling and a loss of enzymatic nitric oxide production. And so again, it's oxidation, it's a loss of an electron. So we have to be able to account for electrons and figure out the electrical potential that's required to extract an electron from BH4. So it's very complex physical chemistry. And again, that's most companies and most people don't understand this because they just don't understand it. They don't have the experience or the expertise. And so that's why we have to prevent the oxidation of BH4. And so, a high sugar diet, anything that leads to an increase in blood sugar, will destroy the function of the enzyme. An inflammatory diet, a bunch of seed oils, processed foods lead to oxidative stress and oxidation of BH4. And a sedentary lifestyle, again, leads to inflammation, oxidative stress, and endothelial dysfunction. So all the standard risk factors that we've known for decades, maybe even centuries now, that lead to high blood pressure, cardiovascular disease, diabetes, all of those are disrupting nitric oxide production.
That's really crazy. How is it connected to the blood sugar problem then? It's still the same pathways?
Well, you have to understand what sugar does. I mean, sugar completely shuts down nitric oxide production from both pathways.
Oh.
So glucose, as the name implies, is glue, right? It's sticky. And if you've ever spilled a sugar beverage on the countertop and you come back the next day, it's sticky, right? So when you get an increase in blood sugar, blood glucose, it sticks to things. It glues things together. It sticks to proteins. It sticks to hemoglobin. And that's what we measure as hemoglobin A1C. It's how much sugar is stuck to hemoglobin. And then, for proteins to do their job, especially enzymes, they have to be able to undergo a conformational change. So, for instance, hemoglobin, when it goes from the arteries to the veins, as it transits through the capillaries, it has to go a conformational change to offload oxygen and pick up carbon dioxide. But if there's too much sugar stuck to it in the form of glucose, it locks it in that conformational change, or the conformational state, and it can't deliver oxygen. And that's why diabetics have ischemic vascular disease. That's why they're hypoxic. That's why they have diabetic macular degeneration. That's why they have peripheral neuropathy. They're not getting enough oxygen to the tissue. So that's one. It sticks to the enzyme nitric oxide synthase to where basically it can't do the job. It glues that enzyme closed to where it can't transfer electrons and perform the biochemistry. And then number two, excess sugar completely changes the microbiome. The microbiome in the mouth and the gut completely changes it. It makes it more acidic. It allows for the caries-causing, pathogenic bacteria to colonize and to overpopulate and kill off the non-pathogenic commensals. So it creates an environment for the opportunistic bacteria to really take over, and it leads to dysbiosis. So sugar, anything that leads to an elevation in blood sugar, is the absolute worst thing you can do for your health and longevity, because it completely shuts down nitric oxide production. And then you can develop ED, you develop, neuropathy. Every symptom that we know in diabetes can be explained by a loss of nitric oxide production.
It's also, I read over here, like you said, dementia and Alzheimer's disease, but, the light version can be a memory loss, brain fog.
For sure.
I mean, that's with the vasodilation problem, correct?
No, that's correct. So if you look at what we call cerebral blood flow through functional MRIs or SPECT scans, you can see in people with brain fog, concussion, any neurological condition, including dementia and Alzheimer's, there's what we call focal ischemia, meaning that there's portions of the brain that aren't getting adequate blood supply. And why is that? It's because the blood vessels have lost the ability to produce nitric oxide to dilate the blood vessels to perfuse those regions of the brain. And so if you're not getting oxygen and nutrients to certain regions of the brain because of inadequate blood supply, then those cells can't do their job. You get protein misfolding. You see it as amyloid plaque and tau tangles, and that's what we call Alzheimer's. So Alzheimer's is a vascular metabolic disease, and you've probably heard it called diabetes type 3, because we're seeing insulin resistance in the brain. And obviously diabetics have a far greater risk of developing dementia and Alzheimer's than non-diabetics. And so nitric oxide also helps get glucose into the cell and potentiate insulin signaling. So nitric oxide addresses both the vascular and metabolic aspects of dementia and Alzheimer's. And that's why we're developing nitric oxide-based therapies specifically for dementia and Alzheimer's, because it completely corrects it. Not only does it correct it, we can reverse it, treat it, prevent it, and cure it with nitric oxide.
Really? I mean, I'm now my jaw dropped. You are developing treatments besides what you're providing at the conferences.
Yes, we have several companies. The parent company is called Bryan Therapeutics. And we're a clinical stage biotechnology company actively developing nitric oxide-based drug therapy. So we're going through the US FDA, we're going after specific indications. What we develop through our consumer products division are dietary supplements, nutritional products, and skincare and beauty. So We're using the same platform technology to develop drug therapy, but the consumer products work because, number one, they release nitric oxide. So if your body can't make nitric oxide, we do it for you. But we can't make drug claims, and it's not intended to make drug claims. What we're doing is providing a supplemental dose of nitric oxide to kind of level up your production to where you don't become deficient. But in conditions like ischemic heart disease and Alzheimer's, the demands for nitric oxide to overcome the disease process is much different than what's needed to kind of maintain an adequate production in someone that's otherwise healthy or just mild symptoms, if you will. So as we develop this, my job is to develop the right dose, the right dosing regimen, and find the right patient population to successfully complete clinical trials and get FDA approval to where now we have safe and effective drugs available for physicians to write prescriptions for specific indications. And, Alzheimer's is at the top of our list. We're already seeing an improvement in cerebral blood flow, improvement in cognition, and less protein misfolding. And again, that's what we call root cause medicine. Developing monoclonal antibodies against the amyloid plaque and the tau tangles not only has wasted billions of dollars in research and development, but those drugs can't work because the tau tangles and the amyloid plaque are they're the consequences of the disease. They're not causing the disease. So targeting the consequence of disease cannot and will not and does not affect dementia or Alzheimer's. And that's why all these drugs have failed in clinical trials. If these companies have spent billions and billions of dollars from philanthropic organizations, from the National Institutes of Health, if they were just giving me a phone call, I could have saved the government and philanthropic organizations billions of dollars because I knew 20 years ago these drugs can't work because they don't understand the mechanism.
Let's come to your product because I also saw some studies that you did. You have a supplement, the lozenge. I like the taste a lot, yeah. So sometimes I take more than one. Hopefully it's not dangerous because it's like a...
No, in fact, I take one, a couple times a day.
Okay.
Yeah, it's just an orally disintegrating tablet. And, this produces nitric oxide gas. So we're not giving your body precursors and substrates and hoping your body can make it because in most cases, the reason people are nitric oxide deficient is they've lost the ability to utilize those precursors and substrate. So as soon as I put this lozenge in my mouth, I can detect nitric oxide gas coming off of it. So over 5 to 6 minutes as this is dissolving, it's releasing nitric oxide gas. It's going into my bloodstream. It's dilating blood vessels, improving oxygenation, mobilizing stem cells. We see an increase in number of circulating stem cells after you take the lozenge. Prevents telomere shortening and activates mitochondrial biogenesis, so you got more mitochondria generating more energy. More importantly, it's completely restoring the oral microbiome, and it fixes the enzyme in the lining of the blood vessel. So if your body can't make nitric oxide, these products do it for you, but we fix the reason, we improve your body's ability to naturally make it. But you still have to get rid of mouthwash, get rid of fluoride, stop using antacids, get exercise, eliminate sugar, and simple carbohydrates from your diet.
But how long it stays in your system? Because, within the minutes it gets into your system, but it seems like always need nitric oxide, like for all these, blood vessel dilations and all the other systems that you spoke.
No, for sure. So if you look at the physical chemistry of NO, so this is releasing nitric oxide gas. This lozenge I designed to have a resident time of about 5 to 6 minutes in the mouth. So as it's dissolving over 5 to 6 minutes, we're liberating nitric oxide gas. But then nitric oxide enters the bloodstream, and it's no longer nitric oxide gas anymore. It binds to the cysteine of glutathione, it's oxidized to inorganic nitrite, and then it's circulated throughout. So we can look at these second messenger systems that's activated by the nitric oxide that we're releasing now. And they'll have half-lives of anywhere from several hours to 6, 8, 10 hours, depending upon individual metabolism. So if you look at kind of the best thing we look at is blood pressure, right? So through 24-hour ambulatory blood pressure measurements, we see if your blood pressure is elevated, within 12 to 15 minutes, we'll start to see your blood pressure come down. And this blood pressure lowering effect will last 6, 8, sometimes 10 hours. So then, you'll take one lozenge every 12 hours. And so that's on the blood pressure lowering effect. But if your blood pressure is normal or low, like right now, my blood pressure before just sitting here is 118/72, typically. Now, when I put this lozenge in my mouth, it's not going to drop my blood pressure. That's the last thing I want to do, is drop my blood pressure to an unsafe level. So the amount of nitric oxide that we dial in through a single dosage can normalize blood pressure if it's elevated, but if it's normal or low, it's not going to drop your blood pressure. And that's a very, very important safety consideration.
You were talking, I was thinking, so these days we see a lot of strokes due to theories, let's say, like the long COVID, microplaques, and so on and so forth. So would that help people to have their blood vessels more functioning properly and have the blood flow in a proper way?
Absolutely. Because if you have constricted blood vessels, it creates a lot of shear stress in the lining, and it can damage the endothelium. If your blood vessels are more dilated and soft and compliant, now with each heartbeat, the blood vessels can absorb that pulse wave and become more compliant. But I think more importantly, in terms of stroke, is platelets have their own nitric oxide synthase enzyme. And in the platelets, if they make nitric oxide, it prevents platelets from sticking together and clotting. So it prevents platelet clotting or platelet activation. But again, when you lose the ability, when that enzyme becomes dysfunctional, which is what happens during long COVID, then the platelets become hyperactive. They're prone to clotting. And now you have an upregulation of adhesion molecules in the endothelium. So the platelets start to stick, the monocytes, neutrophils start to stick, and all of a sudden, you've got an obstruction and a clot. Or sometimes you'll have a vulnerable plaque that ruptures, and then the platelets start to stick, and you've got an embolus or a thrombus that causes ischemic stroke or pulmonary embolism, or even a STEMI, what we call an ST elevated MI, or acute heart attack. So all of that can be protected and prevented by nitric oxide because it downregulates adhesion molecules, dilates blood vessels, and prevents platelets becoming hyperactive. And what we saw in COVID was the people who got sick and died from COVID were the people who couldn't make nitric oxide. These were the elderly, African Americans, people with previous heart attack, kidney disease, pulmonary disease, high blood pressure. All those are symptoms of nitric oxide deficiency. And so what happens is now you have an upregulation of ACE2 receptors, which the spike protein binds to, and then you've got vascular inflammation, platelets become hyperactive, you get clotting, and you get the hypoxia that we saw in COVID. And all that could be mitigated by giving nitric oxide. In fact, we had a drug in phase 3 clinical trials as an early therapy for COVID patients, and we would give our nitric oxide drug, and we could see blood oxygen saturation go from 76 to 98 within 7 minutes, just breathing room air. So no need for 100% oxygen, no need for mechanical vents. We're just improving the oxygenation of tissue and the delivery of oxygen and correcting the hypoxemia and downregulating the ACE2 receptors. So now there's no target for the spike protein to bind to. And, I've never had COVID. And I didn't take the shots. I didn't wear a mask. I was in, we had 26 clinical sites all over the U.S. on a plane every week from 2021 to 2025 or 2024. And I've never had COVID. I don't live in a sterile world. My body just knows how to deal with it, and I don't get sick.
Before our podcast, I was doing some research. It seems like after this invention or figuring it out, let's say that nitric oxide is so important, it seems like it led to development of new treatments for cardiovascular disease, high blood pressure, erectile dysfunction, such as Viagra and stuff. So everything that you're saying, so the lack of nitric oxide is like affecting the heart, affecting the brain, affecting like almost every organ because the blood flow is not proper.
Right. It's a systemic problem.
In Turkey, we're having a really hard time. So I'm mostly trying not to talk too much about the product, which yours is very special and I'm using it because it's very difficult to, order and it doesn't go through the customs. So I don't want to just talk about the product. But for people who are not being able to, access to your product, what are the life interventions that one needs to live or one needs to first drop? Not do, and then add a new lifestyle? And how long will it take to shift from a bad system to a good system?
Now, look, I think it's the most important question. I, too, am less interested in promoting products rather than promoting, a good lifestyle so that your body can naturally produce nitric oxide on its own. But, you hit the head on the nail on the head. Number one, you have to stop doing the things that are disrupting nitric oxide production. So that means getting rid of fluoride. Fluoride is is a neurotoxin. It shuts down your thyroid function. And as I mentioned, it's an antiseptic. So if you're using a fluorinated toothpaste, you must stop. If you have fluoride in your drinking water, I encourage you to get a home filtration system to eliminate the fluoride that you're exposed to. Number 2, stop using anything that's antiseptic. Antiseptic mouthwash, anything that says it kills bacteria, you should avoid it. And then if you're on antacids, you have to figure out how to wean off antacids. They're some of the most difficult drugs to wean off of, and you can't stop them cold turkey. You actually have to wean off of them.
Why?
Because you'll get a rebound effect of hyperacid secretion, and their life will be miserable. So what you have to do is tailor or wean off of these drugs. So what I recommend is if you're on these and you've been on them for a number of years and you take them every day, cut the dose in half. And I'll take that half dose for 10 days. And then after 10 days, take that half dose every other day and do that for 10 days. And then the body, it's kind of dampening the effect on inhibiting stomach acid production in the pyloric cells. Now your body can actually make adequate amounts of stomach acid and you don't get the reflux. But again, don't eat late at night. Don't eat offending foods that cause the reflux in the first place. And then, the other thing is intermittent fasting. If you can eat your last meal at 6 and not eat till the next day at noon, that has remarkable effects on resetting your metabolism, overcoming reflux, poor digestion. I mean, those are really game changers, and the science on that is really undeniable. So, and again, stop eating anything that leads to an increase in blood sugar. And these continuous glucose monitors are now readily available. I encourage everybody to get one and just monitor, because I may eat something that may not cause an increase in my blood sugar, but you eat the same thing and it spikes your blood sugar, causes damaging effects. So understand how your body responds to certain foods, and if it leads to a spike in blood sugar, then just avoid it. Dampen that insulin and glucose response. But those are the biggies. Avoid sugar, simple carbohydrates, fluoride, antiseptic mouthwash, and antacids. And that's cost savings, right? I'm not asking you to do additional things. I'm asking you to stop doing things that are costing you money and costing you your health. So once you do that, and we published in 2019, in as little as 4 days after stop using mouthwash, the oral microbiome is completely reestablished, repopulated. The good guys come back and they police the bad guys, and we want to create a healthy ecology in the mouth. And now, again, high protein diet. The older we get, the more protein we need. Good fats, limited carbs, some green leafy vegetables, intermittent fasting, 18 hours. And
why high protein, you said?
Well, because the older we get, our protein demand becomes higher, because we need to prevent the muscle loss and the bone loss we see in the aging population. And the only way to do that is to increase your protein consumption. But you have to have stomach acid in order to break down proteins into amino acids. So very important. And then, healthy fats, no seed oils, throw in some green leafy vegetables. And then we have to move. We have to exercise. Exercise stimulates nitric oxide production, activates it, 20, 30 minutes a day. And if you don't have time, now there's data showing that 4 to 6 minutes of high-intensity interval training is enough to stimulate increase in heart rate, increase in breath rate. And then nasal breathing. If you're a mouth breather, you have to stop that, because mouth breathing completely disrupts nitric oxide production, changes the ecology in the microbiome, causes dysbiosis, and completely shuts down nitric oxide production. So, I encourage you to go see an airway specialist, a dentist, to make sure you have an open airway. And then if you're a mouth breather, tape your mouth at night.
So the mouth breathing would turn the good bacteria into a bad bacteria, I guess.
For sure, because it lowers the pH of your saliva. The mouth is not an organ for breathing, right? So if you're breathing through your mouth, it's fully oxygenating the oral cavity, lowering the pH, changing the bacterium, and now you've got caries-causing bacteria, you've got bad breath, you've got halitosis, and then people want to use mouthwash because they're mouth breathers. Now they're exacerbating the whole condition. But it starts with mouth taping, breathing through your nose, activating nitric oxide production, and preserving the bacterial ecology that's responsible for producing nitric oxide in the mouth.
Are there specific exercises that would promote more nitric oxide?
No, I mean, what I recommend is just, be active, move. and do things that are going to increase your heart rate and your breath rate. So moderate walking, a brisk pace where you can still breathe through your nose. If you mouth tape while you're walking, it's forcing you to do nasal breathing. It's going to increase your heart rate. It's going to increase your breath rate. And all that is health promoting. But, if you're doing strenuous exercise, obviously you can't tape your mouth because you can become hypoxic. But moderate physical exercise where you can still comfortably breathe through your nose, through mouth taping, I think is a really good idea, especially for those just starting out. You have to start somewhere. Start with just walking 20, 30 minutes a day and focusing on nasal breathing.
Would you like to share a little bit about your lifestyle? Because I know that you're a real biohacker.
Well, look, it's hard work staying healthy, but it's harder work getting healthy if you're sick. And so if I'm going to put in the work, I want to put in the work to not get sick. So for me, and look, this has changed with me over the past 20 years because obviously chronologically I haven't gotten younger. Biologically, I've gotten younger. But here's what works for me. Every day I do an 18-hour fast. I eat my last meal by 6 p.m. and I don't eat till noon the next day. And so that completely resets your metabolism. And then every morning I wake up before the sun comes up, usually 5 or 5:30. I exercise. I, typically do 100 push-ups, 100 squats, high-intensity interval training, over 5 to 6 minutes. And then I sit in an infrared sauna for 30 minutes, 170 degrees for 30 minutes. So we're sweating, we're detoxing. The infrared light is activating my mitochondria. And during that 30 minutes, I'm in my sauna. That's when I do my daily prayers. I express gratitude, and really focus on how can I be better today than I was yesterday, both personally, professionally, spiritually, all aspects. And then I kind of plan out my day. Every day I wake up and I've got a game plan. I have things I want to accomplish, I have to accomplish, and then how do I execute that? So mentally I prepare a game plan. And then, a couple times a week I'll do a cold plunge, 3 minutes at 37 degrees. The contrast therapy, again, the science on it is very beneficial. I eat a light lunch, high protein, little carbs, and then I'll eat a sensible dinner. And then I take some supplements. I used to take a handful of supplements. I don't do that anymore because I find that my body doesn't need it if I eat a good, whole food diet. I take organ meat capsules every morning. I take salmon roe. Before I get into the sauna, I'll take some chlorella and spirulina as binders to bind any toxins I may have present. And then I take my nitric oxide products to maintain adequate circulation and blood flow and keep my telomeres lengthened and long and stem cells in circulation and keep my mitochondria healthy. And that's pretty much it.
You said something about L-arginine and it's stuck in my mind. Can you please clarify more about it and why it's often ineffective and even, they say, detrimental for nitric oxide production, especially for people that has endothelial dysfunction?
No, for sure. So arginine is an amino acid that binds to the nitric oxide synthase enzyme, and that enzyme converts one of the nitrogens on arginine into nitric oxide gas. So arginine is what we call a semi-essential amino acid, and it's semi-essential and not essential because our body makes it. And so we get arginine from the breakdown of proteins we get from our diet, whether it's plant or animal-based proteins. There's usually arginine amino acids in protein. But it's also produced in every cell in the body through the partial urea cycle. So we're never deficient in arginine. And so what we're finding, and there's clinical data to corroborate this, that if you give arginine to a patient that has a dysfunctional NOS enzyme, the enzyme is uncoupled, then it can push that enzyme to make superoxide, which is a toxic oxygen radical that leads to oxidative stress. In 1996, a paper was published showing that people who had just suffered a heart attack, they were giving high-dose arginine to try to improve nitric oxide production, improve, cardiac function from the heart attack, and they found that, and this was a double-blind, placebo-controlled study, and the patients, the group that was getting the arginine, had a higher mortality and higher morbidity than the placebo. In fact, they stopped the clinical trial halfway through because it was unethical to continue killing patients with the arginine treatment rather than the placebo. The investigators were well-intended. They just didn't appreciate the biochemistry and the enzymopathy that doesn't allow for the adequate production of nitric oxide. We got to focus on restoring the function of the enzyme, and then the body can take the arginine that's already present and convert it into nitric oxide. And then the same thing happens in patients with peripheral artery disease. You give them arginine, they get worse. Because again, you're not out of arginine. It's like putting gas in a car with a blown up engine. Let's focus on fixing the engine, then the cell can use the arginine that's present in the cell already to make nitric oxide. And the other thing that's very important, and unless you're a biochemist, you wouldn't understand this, but there's a binding constant, the amount of arginine that's required to theoretically bind 50% of the binding sites on the NOS enzyme. And that's only 5 micromolar. But even in the sickest of sickest patients, intracellular and circulating levels of arginine are 100 to 200, 20 to 40 times more in excess than what's needed to bind to the enzyme. So again, it just goes to show we're never out of arginine, and taking arginine supplements can actually do more harm than good. So then the other thing, it can, the body always responds. And so you can upregulate arginase and divert arginine away from nitric oxide. So, and that's really how I tell the companies that are selling so-called nitric oxide products, if there's arginine or citrulline in their products, it's very simple. These companies don't know anything about nitric oxide biochemistry or science, or they wouldn't be giving these amino acids in their products.
In the fitness world, it's used a lot, the L-arginine, and based on what I'm hearing from you, I don't think these guys are very healthy, especially in the bodybuilding area.
Well, look, only about 3% of the arginine that's available in the body goes to make nitric oxide. There are many other metabolic pathways and where arginine can activate certain signaling cascades. For instance, I think there's some data showing that it can, stimulate growth hormone release. But what we've looked at is kind of the flux of arginine to make nitric oxide and what disrupts and what interferes with that. And the data are very clear. Giving excess arginine provides no nitric oxide benefit. In fact, many of these companies years ago, decades ago, came to me and they go, Nathan, tell us, how do we get caffeine out of our arginine pre-workouts? Caffeine is very important because it's an ergogenic aid. The perception of the workout seems less. So almost every pre-workout product on the market has caffeine in it. And I argue, look, caffeine's a vasoconstrictor. If your product is producing nitric oxide, if you've got caffeine in it, it's going to lead to an antagonistic vasoconstriction. So they go, well, we can't take caffeine out because we've tried to do that, and then people tell us that the product doesn't work. And I go, well, there's your answer. You don't have a nitric oxide product. You've got a caffeinated product that you're selling as a nitric oxide product. And so, again, if you don't understand the physiology and the biochemistry, you can't develop products that actually promote nitric oxide production. And that's what 99% of these companies out there are guilty of. They just don't understand it, and they're creating false promise to the consumers, and it's very dangerous. Because, you'll get people say, well, I heard you, Nathan, on your podcast, and I've been taking a nitric oxide product for years that I saw advertised on TV, and it hasn't helped my blood pressure, it hasn't helped my energy, it hasn't helped my ED, so nitric oxide doesn't work for me. And that's what I hear. I wake up every morning, people sending me emails, and that's a very dangerous interpretation, because nitric oxide always works. The problem is those companies selling you that product that doesn't work have failed you, and it could kill an entire industry. Because if consumers and physicians and healthcare practitioners and regulatory bodies come to the conclusion that nitric oxide isn't effective and not a viable therapeutic option, it could kill the entire field. And then these companies out there trying to sell nitric oxide when their products don't produce nitric oxide will be responsible for that. That's why I wake up every morning and try to hold these companies accountable. I've been sued by these companies. Me proving that their products don't work online at medical trade shows, they sue me. And it's cost me millions and millions of dollars to maintain the integrity of the field. But I'll continue to fight, despite lawsuits or not, because consumers, physicians, regulatory bodies need to understand real science versus creative, deceptive marketing. And consumers especially deserve the right to understand what is the science so they can make informed, educated decisions on products that actually work. Because when you make a product that produces nitric oxide, it always works. And every morning I wake up, just this morning I posted, we change people's lives. Because if your body can't make nitric oxide, we do it for you. Their blood pressure normalizes, their energy improves, and their body gets better. Their body's able to heal. And that's what we're after.
You have also this skin serum that I saw that, it really heals like open skin wounds. It's also the same mechanism?
Yeah, so it's nitric oxide. Look, everything we do is nitric oxide. And so, again, nitric oxide is a gas that we have to produce. And in this technology I developed here, it's a dual chamber. So we have to maintain separation of these components. But when you take one pump from one side, one pump from the other, and you mix it together, and then you apply it to the skin or a wound or whatever, it's going to increase nitric oxide production. It's going to dilate the blood vessels. It's going to recruit capillaries. And now we're getting blood flow to that area. In fact, when you apply that serum to your skin, you'll see your skin turn pink. Mm-hmm. And that's not an allergic response. It's actually capillary recruitment and recruiting blood flow. So we're improving blood flow to that area. And so, we sell that as a skincare and a beauty product for fine lines and wrinkles, for, improving tone, texture, and clarity of the skin. It's an anti-aging serum. Mm-hmm. But again, using the same technology, we're developing it as a drug therapy for non-healing wounds and diabetic ulcers. We haven't seen a wound that we haven't been able to heal with nitric oxide, because what is a non-healing wound? Well, it doesn't have enough blood flow to it, and it has a chronic infection. What does nitric oxide do? It kills the bad pathogenic bacteria, and it gets blood flow to the wound. And what does that do? Well, now the body's able to heal the wound. You get tissue granulation, you get tissue growth, you mobilize stem cells, and you heal a wound. And so that's another drug therapy that we're working on through Bryan Therapeutics. And, in the U.S., 65,000 Americans die every year in nursing homes from wounds that become septic, and they die from it. And to me, that's unacceptable because, again, nitric oxide, we haven't seen a wound at any stage, including my dad, who was a paraplegic from a car accident. In 2014, he had a 4-year-old non-healing wound that he almost died from, became septic, and all the wound care docs that I took him to said, you can never heal this wound. I started applying nitric oxide to the wound. 6 months later, we completely healed his wound. And that opened my eyes to this. If I can close a wound, a stage 4 osteonecrotic osteomyelitis wound in a diabetic, paraplegic, 64-year-old patient, then there's no wound that's the worst wound that there is, and we could heal it.
It's such a simple mechanism, but it seems like difficult to be able to reach to that specific compound.
Well, that's the challenge, right? You have to, again, understand that nitric oxide is a gas. This isn't a pill you can swallow or something you chew on as you see on TV. We have to be able to produce this gas for you. It's a hormone. It's like hormone replacement therapy. We got to give you the actual molecule. But I think what we do, I know what we do is different than anybody else, because we're fixing the reason your body's lost the ability to make nitric oxide. Restoring the oral bacteria, fixing the enzyme in the lining of the blood vessels. Now your body's able to produce nitric oxide on its own, but if your body can't make it, then we do it for you. And I think that's why this technology is so important, and I'm truly convinced it'll change the world, because there's only 2 people in the world who need nitric oxide. Number one, it's people like me who are healthy and don't want to get sick. You have to take nitric oxide. Or there's the people who are sick and tired of being sick and tired when conventional medicines failed them. They need nitric oxide because your body cannot and will not heal without it. And most of the drug therapy that physicians are giving to their patients are further suppressing nitric oxide production. So let's focus on developing drug therapy as a foundation for nitric oxide restoration. And now many of the symptoms will resolve themselves. And, our goal is to understand the mechanism of disease to the extent that we can fix it and eliminate drug therapy. Give the body what it needs, eliminate from the body what it doesn't need, the body heals itself.
Did you have cases that people from erectile dysfunction who are using, let's say, Viagra, that they stopped that and started using your product and they were able to have a healthy sexual life?
Yeah, that's one of the top responses we get. And when you understand how these PD-5 inhibitors work, the Viagra, the Cialis, they work downstream of nitric oxide. These drugs were approved by the US FDA in 1998, so they've been on the market now for 26 years. And they only work in 50% of the men in which they're prescribed. So 50% of the men who go to their doctor with erectile dysfunction that are given Viagra, only 50% of those respond with better erections. And the reason they don't respond is because the body's not making enough nitric oxide to activate that second messenger system in which these PD-5 inhibitors are working on. So to answer your question, if you take our nitric oxide, we dilate the blood vessels. So that alone will improve sexual function. But it can potentiate the effects of the Cialis, the Viagra, because it's going to prime the pump, literally and figuratively. So now you get more substrate for these drugs to work on, and it leads to better vasodilation. So the combination of our nitric oxide lozenge with low-dose PD-5 inhibition therapy is a game changer for sexual dysfunction in both men and women, because it's going to lead to vasodilation, better sexual function, better engorgement.
You just came out with a toothpaste that in my last trip to America I ordered. What's in it and why it's special? Because it took you a while to you producing it, yeah?
Now, this was about a 4-year project. And so, I've known to avoid fluoride for probably the past 20, 25 years. And so I was buying a non-fluorinated toothpaste that, number one, it was important because it didn't have fluoride. But number two, there were still things in those non-fluorinated toothpaste that I didn't like. The detergents. And then I thought, well, I can do better. Number one, I can eliminate the fluoride, the detergents. But number two, let's put things in there, because as we begin to do more research and understand the ecology of the microbiome, what can we put in the toothpaste to act as a prebiotic and restore the normal flora? But then number three, how do we remineralize the teeth that's going to leave the teeth, eliminate the plaque, create good, healthy, remineralized teeth, and provide fresh breath? I think that's the objective of toothpaste and oral care. And so it's a hydroxyapatite-based toothpaste. So it's remineralizing the teeth. We put prebiotics in there. We put things in there to leave the mouth like a mini fresh breath. But everything we're doing, we're targeting the oral microbiome. Because in 2014 and then again in 2019, we showed that eliminating the microbiome with mouthwash causes blood pressure to go up. Now the question was, if we can target the microbiome and restore the optimal microbiome, can we bring blood pressure down? And the answer is yes. So targeting the microbiome with our new toothpaste, we're seeing an improvement in nitric oxide production. We're seeing improvement in blood pressure. And now think about the public health implications of this. High blood pressure is the number one driver of the number one killer of men and women worldwide, which is cardiovascular disease. And simply by switching to our toothpaste, targeting the oral microbiome, enhancing nitric oxide production, we can bring blood pressure down and decrease the incidence, because every 1 millimeter mercury increase in blood pressure, you increase your risk of cardiovascular disease by 1%. And simply normalizing blood pressure based on a healthy microbiome by using our toothpaste, it's going to change the world. It's going to change the trajectory of cardiovascular disease.
It definitely does. And also, some people cannot help themselves not to be mouth breathing because, they may have sinus infection, something. Yeah. And, so basically that's also going to help them not to absolutely kill their good microbiome in their mouth, because you keep
we keep feeding them. Yeah, you got to keep feeding them, right?
Wow, that's I'm glad that I have that too. Nathan, you're doing an amazing job. I know that you devoted your life to it, and you're only focusing on one thing, and that's very important, because most people start with one product and then they have one molecule and they have a bunch of different things, and it's hard to I don't want to say hard to trust them, but I see that how much you devoted yourself into this one molecule.
Yeah, no, well, I think trust is a big issue, and then look, there are other companies out there that make really good products, but nitric oxide is not an easily a product to develop. And that's why, I ask that if people are looking for nitric oxide, trust us. That's what we do. Glutathione is important. I have people come to me all the time and want me to sell a glutathione product. And, our metric is nitric oxide. We only bring to market products that produce nitric oxide and improve the body's ability to produce nitric oxide. And I hope people trust the science. I've been doing this for 25 years now. They trust what we're doing is based on physiology, understanding the underlying biochemistry, how the human body makes nitric oxide, what goes wrong in people that can't make it. And then we provide products that overcome that. But that's our metric. That's our long-term vision, is to bring nitric oxide products in every major market segment around the world. And, we do it better than anybody in the world, and we'll continue to lead the way and call out these companies that are, deceptively, frauding the consumers. Yeah, because it's, as I mentioned, it's very dangerous.
When would be your pharmaceutical grade product is out?
We've got a drug we're working on for ischemic heart disease. That's our first kind of drug target. But I think within the next 2 years, we should be through the clinical trials and hopefully have a drug approved and on the market for use. And then, the Alzheimer's drug studies, a little bit bigger project, can take a little bit more time because we've got to enroll the right patients and look at the relevant endpoints. It's probably 3 or 4 years realistically. And then our topical drug for diabetic ulcers, those are the 3 active drug programs we're in, is probably, again, 4 to 6 years away. Maybe we can fast track that with the, proper capitalization and bringing in the right people. But, it's a huge unmet need. And, there's really not a single indication where nitric oxide at the right dose, at the right time, in the right patient wouldn't provide benefit. And that's what we're working towards.
Thank you for coming to my podcast. This was very exciting. I think it's super important. I spoke before with many important doctors about the importance of it. Again, I have very well-respected doctors treating me. Your book.
Yeah. Well, let me just say I'll do a shameless plug on my book, but this book here is my latest work. I published it through Brook Tower Press and my agent Alan Morrell a couple of months ago. But The Secret of Nitric Oxide, Bring the Science to Life, really chronicles everything we talked about, from what is nitric oxide, what led to a Nobel Prize, what it is, what it does. And then intermixed in this story is my personal journey of discovery and how we made simple observations that allowed us to really think differently and think, how do we develop innovative product technology? So if you want more information and really get a full understanding of nitric oxide, then this is a must read, and you can get it at nathansbook.com or anywhere books are sold, Amazon, Barnes & Noble. But an absolute must read for anybody who's interested in this subject.
I think that, the people should read, but, I'm the only podcast in Turkey that are talking on these topics. So probably it's going to be their Turkish audience, regular
we'll
audience.
Translate it.
It's going to, no, I would, you should probably, but we translate the podcast in Turkish. So they're going to be understanding at least what we're talking about. But, I'm very proud of the podcast that we're able to bring the most important knowledge and innovative findings to my country because, I really trust you guys, and you guys are doing amazing job. Each time I come to these conferences in the United States, I see you, I see some other doctor friends of mine that they're coming up with such amazing interventions. Thank you for your work, and thank you for being here, and probably I'll see you soon somewhere in America again.
See you in December probably, yeah?
Yeah.
Okay, well thanks so much for having me.